Governor Thompson, thank you so much for joining us today.
Well, Mark, it's a privilege, and thank you for coming out from Philadelphia to do this.
So tell me, what's going right and what's going wrong in healthcare payments?
Well, I think, first off, we have to do what's wrong, and then I'll get into what's right. What's wrong is that the way Obamacare, the Accountable Care Patient Affordability Act was put together, never really had a public hearing. It never had the expert kind of doctors and medical and insurance opinions at a public hearing. It was pushed through, it was a political document. And as a result of that, most of the Affordable Care Act is going to be put together by administrators and bureaucrats in the Department of Health and Human Services, my old department. And people are just confused as to what direction it's going to go. I tell people that they should be out there in front and start doing things because the experts in the department really don't know the practicalities of it. So put something out there and it may become the standard of care. Number two, I think the taxes are way too much. And number three, we got huge shortages of doctors, especially family docs, internists, gerontologists, and nurses coming into the field. Which brings us to what's right. What's right about it is we're going from a payment system for going from payment on procedures to one that's going to be treating the individual holistically. I think that's a positive step forward. I think we have too many procedures that are paid for just because individual doctors, too many silos. Now we're going to try and break down the silos, get into a more of a uniform, integrated kind of practice. I think that's very positive. It should be able to help the individual become healthier, but also be able to hold down on costs. Secondly, I think what we're seeing is the way that people are looking at innovations. There's tremendous innovations out there that are going to help to diagnose and to be able to treat the patients, whether it be cancer, obesity, diabetes, things that are coming to the market that are really exciting. And I've been very pleased and had the privilege of being involved with several of those companies. But I think overall, we have to realize that healthcare is almost 20% of the gross national product. And it's people like you, Mark, and Orbograph that are in this space, which I congratulate, because that is where the future is. That's where the excitement is. And if you're not in healthcare, I say, why not? 20% of the gross national product. So I think the fact that everybody now is concentrating on it. You look at innovations, you look at the different kinds of treatment, the fact of integrated care, and the way that we're trying to change the payment systems is going to, I think, work to the benefit of individuals. It's going to be complex, confusing at the beginning, but at the end, it should turn out all right.